1:05, we'll call the budgetary meeting to order. If you would, we'll do the Pledge of Allegiance once it's in here. All right, if you join me. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
But meeting called to order?
It is called.
Okay. But to carry on that conversation, I'd have to see the invoice and see what it was that was turned in for the training. So I'm not a part of the administration. I'm just on the fire department. I'm not part of the administration, so I don't know what the invoice was to be able to comment. The only one I can remember was that oil tank battery training in Bird City.
Well, I think we need an agreement from Bird City, and it could be just a interlocal agreement, and we will pay for 50% of the training for their people. That's what we're doing here in St. Francis. And St. Francis city budget...
Well, do we have one already in place, or is this something that, I mean, someplace back
that
in time,
I don't know. I do know that last year, Bird City did not set aside any money for fire department. St. Francis set aside $3,600 for personnel. So
you want to check on that?
I could check on it, because I know they told me they had a fire budget when I was over there talking about the $250 for the stuff.
Well, I was thinking there used to be, and of course, I don't know for sure, but I was thinking there used to be the same agreement with them there was here. So.
I was led to believe that last year, but I didn't even think about last year checking stuff until this year, and then I read St. Francis's budget and I read Bird City's. So that's when I found the difference there.
And it may be an old-fashioned, we find that happening a lot, an old-fashioned verbal agreement that nobody ever written down.
Yeah.
Never wrote down. It could be one of those things.
But it's going to get very sticky next year when the law changes.
Yep, and I think that's...
And we need to iron these issues out, the administrative issues, this year.
I think it'd be my opinion that maybe we invite Lauren, a representative from the city, and Dan, a representative from St. Francis, and we have a, put on the agenda of a meeting and talk about the fire issue and the fire protection issue and get it hammered out, because I think there's a lot of confusion and everybody wants to work together. There's nobody in that circle that says, no, we don't want to be a part of this. It's just a matter of everybody needs to sit down, hammer out agreement, put some ink on some paper, sign it, and be done with it. I think, like I said, I think every party in there wants to work with each other.
Right.
Especially the two fire districts in the two. So there's technically 4 fire departments. There's the rural fire in Bird City, the rural fire in St. Francis, and the city fire in St. Francis, and the city fire in Bird City. But they're essentially 2 departments because it's the same personnel, same all this and that. Because I know, like when we bought the bunker gear in Bird City, that's been probably 7 or 8 years ago. I know Bird City paid for 50% of the cost share on the grant, and the county paid for 50% of the cost share of the grant. So I know there's some things in the past where they've done the 50-50 thing. I don't know if it's a written agreement or whether it's just a handshake. I do know that, again, I think it's a little behind the 8 ball coming in here and asking this, but we did go to a fire, it's been 2 weeks ago now, and it's becoming very obvious to us. And again, I apologize, I'm not part of the administration of the Bird City Fire Department, I'm just the messenger. But their feelings are on the 1980 Dodge brush truck that it is at the end of its service life. It did not make it to the fire before it overheated. Then it fought fire for a little while, overheated. Then they had to wait for it to cool down to drive it home, and then it was boiling hot when they got back to the firehouse. The tank on it, it's got a 500-gallon tank on it. The tank leaks. It's the second tank that we put on it. It's a used tank off of the Dodge fire truck that the St. Francis Rural Fire Department, the county, used to have over here that they got rid of. They've already got rid of theirs quite a while ago, but they kept the tank, so we put that tank on there. and it's beginning to leak now. I mean, it's 30 years old, so 30-year-old fiberglass tank that bounces around the pasture. So I know it's late in the game, but I know Lauren expressed interest into trying to get in the 2017 budget equipment reserve to purchase a used brush truck to replace that truck. He thinks around $45,000 to $55,000 would be the magic number there. But I also feel at a level that, that's about all I have for fire department. I think the big thing was I think, like I said, I think there's some difference of ideas of what maybe handshakes that took place 30 years ago. Some people feel they're still in place, some people they don't. I really think for communication and for us all in our different silos to work better together, I think we do need to have an official, whether it takes place at a regular scheduled commissioner meeting,
Right.
and we just put it on the agenda, but there needs to be a meeting with the four entities, county commissioners and some representatives from the city, and kind of work it out, because this handshake stuff was, people forget about it, and we need to put some stuff on paper.
If we schedule it at a regular meeting, it'll be all documented as well.
Yeah.
So I think that's probably a good idea. Maybe we need to get hold of Dan and Lauren and maybe schedule that for next meeting.
I think that'd be a good idea, because I think, like I said, there's not any misunderstandings of somebody being mad at each other. It's just, they need a direction. They need an official stance.
All right.
And that's all I had about fire departments.
Do you want city officials, would you like me to?
Well, it's like Cody said, get them here with one city official so we have the city's take on it too.
City of Burke City, maybe the mayor from the city of Burke City.
Yeah, maybe Shannon and maybe Scott from over here. Would be good.
Okay.
So, okay. Yes, Life Team. I think we've missed you a few times. Come on up. Okay. Come on up. My name is Brett.
And this is Ed. Ed? Nice to meet you.
Rodney?
Good to meet you, man.
We can do this with this budget meeting, can't we?
Well, you're kind of setting the budget for the.
I talked to the attorney, she didn't see anything wrong with
Okay.
that.
How long are you gonna
As
do?
long as we approach
Whatever
it
you guys need.
from the standpoint of we're looking ahead for next year's budget.
Okay. You got enough room there.
I'm fine.
All right. I think I spoke with you on the phone at one point.
Yes, absolutely.
I'm going to take notes on here. I'll do it here. Okay.
I want to give you just a tiny bit of background of kind of what Life Team is and my background. I've been in EMS for 32 years, 28 of those professionally. I've been with this company since day one, 15 years ago. I was a flight paramedic in Topeka, Kansas, and came down, left the best job in the world to get another one. So we've grown from one aircraft in Wichita to multi-states, Hawaii, Nebraska, Texas, Colorado, Kansas. We're doing helicopter, fixed wing, and ground ambulances. I have actually 6 ground ambulances stationed throughout Kansas and Nebraska currently. Probably the first part of the year, Sherman County had a challenge with their EMS administration staff and needed to make a few changes. So they put out an RFP of just requesting assistance and looking for a company to manage their EMS system versus one person. And it kind of makes sense if you think about it, because if you get a good person in there, that EMS director in a service of this size, Garden City size, Goodland size, is you got to wear a lot of hats, and there's a lot of people and a lot of things to do 24/7. So you just basically wear somebody out and they go on, because you can't afford the depth of management that you might need. So we came out, we met with the county commissioners last May. Actually March, and Dr. Selberg, he's the owner of our company, Candace Boy, and he really that's why he started this company, is the person that chooses to live in a rural community should not pay the price of health care. and have access to the level 1 trauma center or cardiac center, that kind of stuff. The way you do that is by transport. He's was a bird colonel in the Army and has a lot of flight experience with him, so that's a passion of his. So we kind of combined all of his passions to help form this company. So we came out and talked with them and found out a couple things. There was nothing seriously broke over there, so that's the easy part. And then actually just do some tweaking and offer a depth of management. So instead of one person doing all the things, we have departments, education department, billing departments, HR, the whole 9 yards. In our agreement with them is we actually just yesterday is his first day. We hired just the perfect fit that we thought. We looked for about 60 days and found the guy to represent Life Team as a managing partner with Sherman County in their EMS. Along with him, he's a working manager. He pulls shifts, and then in turn, the company backfills him if he goes on vacation, needs some time off, education, the whole 9 yards. So that's kind of what we're doing in Sherman County. One of the attractive parts that I think Dwayne Wright, one of his visions, that he was kind of that instrumental person setting up that EMS system. It's called the Neighborhood EMS Project. You guys ever heard about that?
I haven't.
It's a cooperation mainly in this region of counties that they're setting up their EMS systems to kind of cohabitate with each other. From the concept is protocols, purchasing power, billing power, sharing of employees, and training. So you can't, why should we duplicate all that stuff in all these different counties if we can actually start working together on that stuff? So that was the most attractive part about our company stepping in and helping Sherman County is this vision of the next phase of what we think EMS probably should be, is all those things combined into one. I've actually came out here and met with Reed. He's a great guy and has accomplished a lot of things. I think our company, with our depth and experience, can offer you guys what you deem might need some deficits or some things that probably need some attention. My goal today is kind of listen and then go back. I got a meeting with actually Dr. Soberg and our COO tomorrow afternoon, and see what kind of package we can put together. We're just starting into this. Believe it or not, this is being very focused on at the State Board of EMS level in Topeka because of the vision that it is, and they're excited about it, and they want to support that kind of cross-pollination of EMS. Out of those things that I was mentioning, I think the things that are problem solving right off the bat is this employee sharing, and with the same protocols, the ambulances are set up the same way. That's easy stuff because you can actually be on dual rosters, multiple rosters, and if you have somebody that gets injured, a full-timer, that's very detrimental to a small service. Same thing for over there. So if we're full staff, actually we're hiring to get over full staff, is we actually share an employee for a little while until either hire somebody or somebody gets to the back to where they need to be. Training is a passion of Life Team. We actually have what we call a care network, where the company actually goes out to hospitals and EMSs, and it's a partnership with the company that we do all those, we call them alphabet soup classes, like the advanced cardiac life support, pediatric advanced life support, at a loss for our company. That's how we do our marketing. We don't roll in and give everybody T-shirts and fancy stuff anymore. If it's not affecting patient care, we don't want to do it. So that's how we market the company, is sharing that expertise in education as a kind of that lost leader, I would say. So, what's your challenges? What out of that group or whatever? The ultimate question is, how can we help?
Yeah. Well, right now, we have one full-time position, which is the director, and we have 3 part-time positions, 35 hours or less a week.
Okay.
So that's, and then the rest are volunteers.
Okay.
So that's the criteria that we have that exists today. And we're struggling with the manning issue to cover the calls. And we need better cost data than we have available to us right now. So, and I'm sure with the different departments you have, you can cost that out and tell us what you would propose and what it would cost.
Sure. Are you thinking just running the EMS, augmenting with some help on education? Do you need a change, complete change? How depth do you think, Rodney?
What do you guys think?
Education is a big issue right now. Our volunteer numbers are down. The burnout rate is really high. So if we could get an EMT course going, where we could get some new blood in, and then we could solve all our problems.
Yeah.
So that's where we're at. If that's something that we can do through you guys, I would be interested in that very much so.
Now, currently, we actually are operating out of 2 locations.
Okay.
We operate out of St. Francis and out of Bird City.
Okay.
So we need to look at that. The new state law that went into effect on July 1st on response time, they average it out, and if you don't meet the 5-minute response time, then they can fine the county.
Gotcha.
So that kind of has to be looked at because we are operating out of 2 locations.
Right.
And that's why the staffing is very important.
Yeah.
We are not an economically affluent county where we could stand very many fines.
Yeah. Well, the EMS budget is, I got to take a look at that, and it's tight.
Okay.
Yeah.
Anything else you guys can think of?
Well, your employee sharing, that would be something that I would be interested in. What is the cost to us because right now we're trying to do bid shifts to get EMTs to take call.
It's an interesting approach.
Well, it's the only approach that was suggested to us and seemed to work somewhat well. But you can see where there's going to be a lot of,
Playing system.
yeah. So the employee sharing until we can get people educated would be a very, very good thing. And I guess, what do you think, Ed?
I gotta agree. I think you pretty much covered all of our problems.
On the revenue side, on the billing side, a great example, Keeman, Kansas. They had some challenges on keeping up with all the changes in Medicare, Blue Cross, the whole 9 yards.
Mm-hmm.
We brought our billing in-house, I think about 13 years ago now, and hired just the best person for that job. How somebody can have passion about billing and ICD-10 codes, I have no idea how, but she does. And I think she has 7 people in her department now. They took over Kingman's billing, and the percentages rose, the past collections rose, and they actually invited Nancy Ratcliffe. She's our billing director. She's also the Blue Cross Blue Shield state representative for EMS, so she goes to each region and teaches them on the new changes and all that kind of stuff back to their county commission. They had some serious questions of where did all this money come from. They found $130,000 in that first 6 months. And basically it was past accounts that had just fell to the side, and they went back and found monies that the insurance should have paid and all that kind of stuff. So that's probably something you can seriously take a look at, even after maybe even doing initial billing and then follow up after that. That's something we're considering to doing with Sherman County as well.
Last year, ambulance runs brought in $115,943, and transfers brought in $13,814. So that's,
Any idea on how much they actually billed out to get that 100?
well, see, I don't know how much was billed versus what we
Actually,
actually received. And
Coding is huge, I know that.
it is.
I
bet you do,
When
yeah.
you said somebody enjoys doing ICD, and that's why I chuckled. I'm like, wow.
Yeah. When you have a code that for just specifically get sucked into a jet engine, that's how detailed these ICD-10 codes are.
Yeah.
Believe it or not.
Doesn't happen every day, though.
You never know. You never know.
Well, there's several different avenues, the employee sharing, education. We're trying to do what we can to maintain what we have. And we definitely would reach out to you for some help, and I appreciate you coming. You guys have anything else?
I
Do you have
don't.
any questions for us?
I kind of how would you like the information to come back? Just make another appointment with you guys and just...
Either that or send it to Deb and she can send it out to us. I would like one of your cards if you've got one.
Absolutely. Yeah.
Okay.
Absolutely.
okay.
Because if I come up with something else, I'll give you a call.
The regular commissioner meeting will be on the 29th of July. The 15th and the last working day of the month
Okay.
is when the board has established their meetings.
Okay. I know I'll be out on the 29th, not available, so probably email and...
Send me and I'll copy it for them, put it in their packets.
Fantastic. And don't worry about, call me anytime, basically, because I got a lot of bases and they don't worry about it, so you shouldn't either. Appreciate your time, gentlemen. Thank you very much.
Yeah, thank you.
Finally, thank you.
It's okay.
That happens all the time. Okay, Jeannie, did you have anything?
No.
Okay. All right, let's get rolling on this.
Yeah, you got yours open.
How do you want to approach this? Estimate 2% increase for
Cost of living?
salaries, and then when the official consumer price index is published, that's what we would automatically raise the employees?
That would work.
Because the consumer price index is out at the end of October.
Okay. What about the ones that we were going to do, like 3%, or you just want to wait until that study comes back to decide that?
I think we need to.
Okay. Since I think we made a motion on that, though.
I think we did too.
Well, we set the minimum and maximum wages.
But clear back when we went
Oh,
through.
yeah, but before we'd set and we told them we'll give you 3% next year, and I think we
Oh,
got that in
I
right.
see what you mean.
So if we're going to do it the other way, we're going to have to.
We're going to have
do
to
this.
rescind that.
Why don't we wait until next meeting to decide that in at least ask Nicole.
Yeah.
So if we want to just do a cost of living of 2%, and then we could look at how we need to go about the other, we can.
I think so.
Okay. Is that what you guys want to do, is the 2%?
2%.
That's fine with me, if you guys are okay with it.
Well, yeah, but what about what we promised these people that didn't get a raise? What do we do there? That we
Well,
promised
but
3%.
but everybody did get a raise last year. Everybody
that's
got a
true.
raise last year.
Okay.
It's how we're going to settle the raise for next year. That
Okay.
And we won't know that until we get their
No.
data back.
and then starting next year, that's going to be the law anyways. So I'm looking at it, if we start it this year, based on the change to law, which will go in effect, everybody will understand how raises are going to be done.
Okay. Well, I'm okay with 2% across the board then, to start off with.
For budget purposes.
Yes. Okay, where do we want to start at, guys?
Well, the book is set up with grant administration.
Okay.
If you took her salary times 2%,
I didn't figure that right. I could see that right off the bat.
And do you want that set as half of it coming out of grant administration and half of the salary coming out of emergency management?
Yeah, that's how I've got it written down in the notes. Grant administration 50, emergency
So if you-
management 50. And I think that's
Okay.
that's what I wrote at the bottom of mine.
let's write that
You want this figure?
43,806.
0.86.
And then if you divide that in half, half of that would go into grant administration and the other half
You
goes
have that
into
21,903.
903,
21,903.
34, huh?
34. Okay.
40,
This
44,
looks
huh?
That
Okay.
happens. Okay, so that is the county. Okay, that is another grant. And then where's- And this has the 6% raise increase that are already added to it, I take it.
Well, that's kind of what I'm wondering.
Is that what you got here? The same figure?
As, yeah,
Okay.
I wrote down the same thing that you did.
Okay. It-
21, what do you got written? 21,903, 44.
Yeah, 44.
It's 34. 34. 34.
Damn, there's gonna be like 9 cents off.
I don't know if you, 43 if you want to round it down. See the period there?
On the budgets, they're not in cents.
Oh.
Yeah.
So I
Oh, you would have been right the first time.
would round them up,
Yeah,
just,
I thought the point was right there. Whoa.
yeah.
All right. You're not dyslexic.
so
Okay.
for budget purposes, we can round it up to even dollars.
Tell people
Yes.
that.
Okay.
Eric says he'll vouch for you.
All right. Gotcha. All right.
I don't know if this is the time that you guys want to address it or not, but which employees are to get overtime and comp time, and that's one question that Carol has always asked, is she going to be considered a department head, or, and that makes a difference whether there's overtime, comp time, or if that makes a difference how that handles if she's an hourly employee. that's one of the decisions surrounding this particular position that needs to be decided.
I don't know how she was originally hired. That
I
was
believe it's salary.
salary?
Well, everybody was a salary.
Yeah.
That's
If we
been part of the problem.
If
Is
we switch
every-
that to hourly, it's going to get pretty confusing because
Okay. Consider it salary then?
that's what I would suggest.
Okay.
Works for me.
Okay, she's requesting $7,986 for her contractual.
Yep.
So if we budget in the personnel, I'm putting in 21,904. I'm just putting it up to the nearest whole dollar.
Better get this shit written on the right page, hadn't I?
Oh, I see. Okay. Where is it with you, Randy? All right, contractual.
If we had the 2% to that, that's what we get.
Let's do a total number.
Yeah, we'd have to add that on, but did you find out how much spent last year? He's checking to
No,
see what was
because
spent last year.
I don't think we broke it out last year, did we,
What,
for grants?
the budget? No.
Yeah.
No.
It was
Well,
in Ryan's,
It was in Ryan's.
yeah.
And just for keeping things a little clear and knowing exactly what was spent and what wasn't, grant administration was a new line item.
Right.
And so those expenses
Do
were
we
in
want to add your
emergency
2%
management
to
last
the
year.
quantities line then, Rodney?
Oh, that's why I'm looking at 15.
Yeah.
I need to look at
And there should be
16.
behind the grant writer, she had a
Yeah.
breakdown of her contractual costs.
Yeah.
Yeah, that sheet right there.
Yeah, she wasn't in the system for 15. Okay, she's asking for the same thing this year as she had last year.
Well, and she's pretty close with her figures and what I come up with. I added the 2% onto that also.
Yeah.
Here's what we come up with, so
Yeah.
that's just.
Yeah, that'll go in this column.
Right, but I mean, that's pretty close. I mean, we're within $600 off. So, well, I didn't add the $600 in there, so yeah, we're right. You know, the 600 for the commodities.
So do you guys agree on 7986?
I don't see why not.
Yeah, that works.
And 600 for commodities?
Yeah.
You want, when you get a budget done, do you want that finalized on this copy? Because this is,
I
I
think-
made each one
yeah.
of you a copy off of this.
Yeah, I think we need to do that. Yeah.
So you can write in there the figures that you want.
Okay. These are the three figures, and we'll just. You want to total them?
What was your total? 29?
949.44 is what I got.
You know what?
I added these up. 29, 949.44. You got 30.
I got 34.90.
Yeah, I better redo it and see if I got goofed up. Can't blame it on the new phone if I did. There, I got 34.89.44. Is that what you got?
I got 34.90. But I just rounded up, so leave off your cents because we need to
Okay.
go in cents and just make it
Yeah,
490.
round it up.
Okay, so
So you don't do that.
30,000. And, yeah, bingo. Okay.
Do you want to write those
Yeah.
figures in that column?
Is that, you guys are okay with that?
Yep.
Yeah.
Okay.
We better be. We all wrote down the same thing.
Well, we're not perfect. Double check signing. I think it's better to sign as we go through them anyway. Okay, so-
You forgot to round that up. You'd have been $1 off.
Get him, John.
Yeah. Get enough of that from my wife. And we're going to public transportation next. Is that correct? All right, public transportation, is that correct?
Yeah.
Okay.
This will be a new account. And she's costed this out for us. And there's attached documentation to it. I think we go with this.
Wow, and of course, we still got the matching fund I wrote down here. Did you write that down?
Pardon?
It says matching fund there, so I'm guessing we haven't received that yet.
We got to pay that up front and then we
Right.
get reimbursed it. Yeah, yeah.
Yeah, it was a nick from the pile. I ain't got there yet. I was getting my cart before mine was.
15607. Five 426. And 6,100. Okay, she's asking transfer to equipment reserve 1,000. Do you want to put 1,000 in there, or do you want to put, say, 500? This is a brand new piece of equipment. How much do you think we're going to have to reserve?
I don't know, we may have to do some additional decaling on it, though.
Okay.
So I think 1,000's
Okay.
a safety bet, a safety,
1,000?
right?
I'll look at this. All right. I'll go over some of my own numbers in my own.
At least you're not arguing with yourself yet.
I give them up 28,133. That's what you get.
Yeah, if you round up.
Yeah.
Okay.
Capital outlay, 1,000.
You know,
So that should come out 28,133.
yep.
Are you taking the consumer price index into consideration?
Pardon?
When you're figuring, when you're doing that, are you taking that 2% consumer
Well,
price?
this is a grant setup.
That is true, but eventually when the grant runs out, it'll become the county's responsibility.
Right.
And the tax lid may still be in effect.
It's a good question. Should we increase the personnel line item by 2%?
I think we could do that when we do the budget next year,
Okay,
is what I think.
yeah,
Okay.
So
okay.
we don't know.
Well, even with the
Yeah.
tax lid, they're going to allow
Right.
the cost of living,
Right.
aren't they?
Yes, they should.
Okay.
I need to do a lot more research on that tax lid. There's just not enough time in the day, guys.
Okay.
Do we have, want to skip to Cody since he's here? That way if we have questions?
Well, his would be the next one up.
We're off $1,000 on that bottom figure, boys. You add that extra $1,000 in there, you're going to get 29,133.
Did you figure both the equipment reserve and the capital outlay? Because that was $1,000 for each one.
Right, that's where she's off $1,000 in her figure.
Okay.
I'm not saying you're wrong, I just want to double check. Yep. Ed's right, I got
29,133.
Yeah.
Okay.
I will correct that. Thank you, Ed. Corrections made. that what you have? Okay. Rodney, want to move to emergency management? That's what I've got next. Cody, you going to stick around for a while? Okay.
Huh, I got sheriff next.
Well, let me see.
I think Eric had brought Cody's in. It should, sheriff
I
and
think it matters where
dispatch
you
should
stuck
be-
it.
Yeah.
Yeah.
Yeah, I got sheriff. We can go to sheriff, but I got it clear in the back.
Pardon?
You want to just
See,
do
it's
sheriff?
set up by numerical order.
You can't do that shit to us, Rodney.
Huh?
We're not in numerical order.
No, you're not.
Our weakness. Come on.
Are you out in La La Land?
Here's dispatch.
Jeannie, have you heard anything from Mr. Kite? I need to give him a call. Did we communicate with him? Oh, okay.
I'm glad you said that.
Make a note of it then,
Oh, great.
because he's so excited.
I'm busy getting the election organized.
Oh, I see.
And I didn't.
My book's set up in department order the same way as the,
Agenda was.
yeah, and you set this up according to the agenda. I see why.
Yeah.
Okay. Personal services?
Are you on that?
You want to go to emergency service
No,
next?
I'm on sheriff.
Okay.
Did you find yours yet?
I'm still looking, but go ahead.
Here.
Should be
Look,
towards the back, Ed.
If you put it in like I did, I had to flip it, it'll be towards the back. But you're already in.
I don't even have one.
All right. Do you want to look off here, or do you want to have a copy of one quick?
Now I can help you figure yours.
Evidently,
I
did.
might have lost some bitch in here. Let me keep looking. Was it before or after fire department?
Should be after dispatch.
Yeah. Should be
Fire-
after
It'd be right before the
dispatch.
fire department.
But if you may not put it in there, Ed. Do you think you did?
That's probably what happened. I probably didn't put it in.
Here, can you run bust a couple copies? Because you won't have Jill here either, I'm sure. She'll just make a copy for you. Thank you.
It's probably in my bag back there.
Okay.
Of course, when I stopped my pickup out here in front of the courthouse, everything went all over hell.
We're gonna go over yours that way. Okay. We might have you leave your gun downstairs.
Found it.
Good. Oh, he found it. Thank you.
It was stuck together.
I knew it. I knew you'd have it.
So what is your recommendation on that warranty?
I don't think I'd mess with the extended.
Okay.
You might-
Well, I was reading your email and I didn't. Okay. Cody, you have
You
requested.
read that?
Yeah, I did. I read
Nice.
them. Most of the time, unless you have an attachment, then I can't download anything.
Oh, there's, you don't have to yell, that's
Yeah.
okay.
Under personal services, you are requesting 254.20 or 250. What's going on there?
Basically, I used the numbers from the Austin Peters
Okay.
Association, which had some wage increases
Okay.
for the deputies and stuff. I came down, I visited with the county clerk and stuff, and I said what numbers do they want to use. We didn't have a clear directive, so I just used the Austin Peters recommendation, because I didn't know what you guys
Do you
wanted to do.
know? Well, if we go with that, the Austin, he went by the
Was that
recommendations.
with the 2%?
Well, that wouldn't be the 2%. That would be whatever they're suggesting.
Yeah, that
Well,
would
I mean, do
be
we
the
get
figure
that
for
2%
this
onto
year.
that?
Yeah, because some of the positions,
That I don't know.
like my position, there wasn't a huge change. In Mike's position, there was a small change. When you get to the deputy level,
There was.
2 deputies, there was a significant change because I think they moved it up from, don't quote me, but I think it was somewhere like $13.75 an hour up
Okay.
into the $17 an hour range. So that's what made the, what is that, see, this year I had 236, so 254, so not quite $20,000 difference was the Austin Peters.
Okay. Well, if we
number.
go with the Austin Peters number, I don't think we should do the 2% then.
No,
We
that would be, that would be
straight
no,
up.
that would be without any 2% cost of
Yeah.
living raises. That was just making the adjustment from their current pay
Okay.
to the Austin Peters
Let's
pay.
find out what that percentage is, because I bet it's close to 2%.
Yeah. And also keep in mind that there's also like Ann, who will be moving up a level after her first year. And I adjusted for all that. That's all adjusted in there for that number.
Okay.
So,
We just have to ask the question.
oh, absolutely. Be prudent.
All right.
It's actually about 6%.
Okay.
So I'm guessing that they'll be happy.
And see, we did the 3% earlier, so that would just be.
Right.
Okay, so that's good.
That'll
Con-
take care of that.
So just,
Contractual services, we've got a little bit of a change, not,
Yeah.
what do you,
And to explain everything, once you go to personnel, we go below personnel until we get to capital, not capital outlay, the equipment reserve. I took the numbers and I did inflate them a little bit because of that tax lid scare. So you guys understand, I want you guys to understand that from the beginning. There is an inflation on this budget to try to figure, what I did was I figured 3 years inflation because the tax lid, I'm sorry. So as you look at this number, that's not 1 year's inflation. I did 3 years inflation, put it in there because I'm afraid that tax lid, in 3 years, we'll need that number with inflation. Do we necessarily need it next year? No, but I'm trying to get my budget to the level that I could survive this tax lid process.
so essentially, next year, you're not going to go up on, except
No.
maybe the personal service.
Personnel services. I gave you numbers that I could hopefully live with for the 3 years of the life of that tax lid. That's kind of
So essentially, with the exception of personal
personnel
services.
and
Okay.
equipment reserve. I didn't do it for equipment reserve because that's not figured, the way I understand reading that Senate bill, that's not figured into the tax lid. That's its own, that's a fleet service, that's a capital reserve. And maybe I'm wrong, but the way I read it, that's not included in the tax lid, is it? The equipment reserve?
well, your budget
Do you think
would be
it's gonna
exempt
lock
from
it
the
for
tax
3
lid
years?
next
I made a
year.
note on
So,
that.
the way I understand that law,
Next year, so.
that would include your equipment reserve.
I don't think you get out of a lot to worry about.
Like I said, if we're looking at this for 2017, yes, obviously there's some fat that could be trimmed off of this budget. But like I said, I'm trying to find a budget that I can live with for the next 3 years if there is a tax lid put in place.
Well, I'm okay with these numbers just because next year we'll have these numbers the same. We'll have the cost of living increase
Yeah.
there. So, I mean,
Okay.
it'll be,
And as you guys know, I mean, being a salesman here, but, last year I returned a significant amount of money, plus I gave $8,000 to the jail fund. I try not to run my
Yeah.
budget over, and if I have money left over, being an emergency service, it's hard to plan
I know it
for
is.
what could be, and if what could be doesn't happen, I'm always more than happy to give that money back to the general fund.
we'll be looking for you for the jail.
Okay, because I'm not one of those.
For that.
I'm not one of those ones, November, December, go spend it all so I have zero. I try to play nice as a team.
Okay. You went down on your equipment reserve.
That's because we had to replace 2 vehicles
Right.
because we totaled one.
Okay.
The plan is to replace a vehicle every year
Instead of 2 a year?
instead of 2 a year.
Okay.
The last 2 times we had to replace because of issues, we've had to replace 2. If we stick to our program of 1 a year, and then
Then
our
we can
oldest
keep-
vehicle will be 5 years old when it's rotated out.
Okay. All right, your total capital outlay. I'm assuming you did that because of
Mhm.
the tax lid as well.
Yes.
Do these get figured in here? Your fees?
Total revenue.
Oh, this is your revenue.
That's what we brought in between the Bird City contract, paper service, bins, things like that. And a lot of that goes back into the general fund, but I'm just documenting that's what I bring in every year.
That money that you got back for the drug stuff, you
Yeah.
wouldn't have that in revenue?
No, we don't want to, the reason I don't want to put it in that marker,
Two separate.
Okay.
because state statute says that we cannot legally use it to offset budgetorial items.
Okay.
So I think we're running ourselves in trouble with the auditors if we wrote that money in there, because then it would appear that we're using that number to offset budgetorial items.
I think we need to write something for the public so they understand how that money was used. I had some people come up to me and they said, "Why are you letting him buy that? I'm madder than heck about that." I said, "You don't understand. That's money that was confiscated, seized, and we basically, if we don't use it, we lose it. Correct?"
No,
okay.
it's just going to sit there. It's going to do
Okay.
no good. I mean,
Okay.
it's sitting in an account. We could sit there, it gains no interest.
Right.
It does nothing, but it could offset expenses to the taxpayer. The taxpayer
Right.
bore no expenses in that.
Right. And that's where I was wanting to make that clear with this person. I
You
think
have guidelines that money
Yeah.
can or cannot be
Yeah.
spent on.
Yes, I have state guidelines, and I usually run, if it's something that is in the gray area of the guideline, I usually call Colin Wood. He's an attorney that specializes in asset forfeiture, and I call him and I'll run it by him and say, hey, and he has told me no on several things.
Okay.
So
Yeah,
there's several.
straight down the line, he runs the calculator well.
Yes, he does. Rodney, you okay with those numbers?
Yes.
Okay, do you have his, you'll go ahead and do it. Jail care, there's really no way to,
No, I mean, I increased it a little bit just to, I always increase it.
well,
Just to
it's a
say-
gamble, you just don't
Yeah.
know, and you'd rather be,
But as far as, when we return back to that drug fund, that's what I call it, is a drug fund. I am accountable to you guys once a year when you guys do the audit. When the auditor comes through, I have to provide you guys with an audit of that money, which is pretty simple. That's one of the reasons why Deb's already got that information.
Yeah.
And I did that on purpose so there wasn't any questions of, I'm not out there secretly buying stuff that nobody knows about. Everything is in, every invoice goes to Deb through accounts payable to pay. So,
I think we need to raise that one. Because we're over this year already.
you're on the next one?
I'm on
Jail
the
care is what
Oh,
we're looking at now.
I would agree, look over that, and if you agree, sign it. I didn't even sign it yet. Dang it.
and this year,
Go ahead.
I had to sign Medicare stuff today, so my hand is misery.
this year was an exceptional year on juveniles. Now, there's been some changes in the juvenile law to where some of the people who were put into JJA custody this year by the change of law will not be put in JJA custody in 2017. They made it more lenient on the juvenile law when we can arrest and detain in a detention center. So I'm hesitant to say we need to raise that juvenile number.
Can you sign that too, please?
And because of that change in law, I don't think we'll be detaining as many juveniles as we have in the past.
I'm sorry.
Oh, it's
Yeah, we're 126.80 on
on
juvenile.
Yeah. And that's because of two particular
I got you.
juveniles. Like I said, this is an exceptional year. This isn't something that, I say that and it'll happen again next year, but I'm just saying,
I'll tell you, I told you so.
yeah.
I think your
Well,
numbers.
you're the commissioners. You guys make the decision. I'm just,
I think your numbers are good because you just don't know what's going to happen.
Yeah,
So I agree.
I'll go with it.
Can I have that sheet, Deb?